Hello, SHRM family. Welcome to another edition of the WorkplaceTech Spotlight. I'm Guillermo Corea, Managing Director of SHRMLabs, SHRM's Workplace Innovation Lab. I'm your host for this series where we shine a spotlight on some of the most interesting future of work topics, innovators, and disruptive technologies. Before we get started, just a couple of quick announcements. For SHRM members, just a friendly reminder that the Workplace Tech community is live. This is the TripAdvisor for HR tech, and it's available only to SHRM members. So please visit workplacetechcommunity.shrm.org. For workplace tech innovators and startup founders that might be listening today, the application period for next year's Workplace Tech Accelerator is now open. The application deadline is November 13th, and this is the top workplace tech accelerator in the world, and it's a very competitive program to get into, so please submit your applications today. For those of you watching on LinkedIn or other social media platforms, please share this live stream and tag SHRM. You can also use the hashtags SHRMLabs and WorkplaceTech. So today we have a great topic that we're going to be discussing, and let's get right into it. So according to SHRM research, 1 in 3 U.S. employees say their job has had a negative impact on their mental health over the past 6 months, with 30% saying their job has made them feel overwhelmed, and 29% saying this made them feel anxious at least once a week. 27% of Gen Z workers say their job has made them feel depressed at least once a week in the past 6 months. In a 2023 study by Executive Networks, HR leaders reported the highest level of burnout among all working professionals who were surveyed. And this is no surprise. Work is a cornerstone of most people's lives, and feeling unsupported, disengaged, and unwell at work will have lasting consequences in and out of the workplace. So what can organizations do to help support the mental health of their workforce? How can we prevent burnout? And how will technology help HR and organizations better support the well-being of their workforce, especially when you consider that the workforce is the #1 resource that organizations have? So joining us to talk about this topic today are Chris Calitz, National Executive Lead for Health and Wellbeing at the American Heart Association, and Carla Dawson, Chief People Officer at Texas Health Resources. Carla and Chris, thank you so much for joining us today. Welcome to the stage. And, we've got a great topic of discussion for today, a short amount of time in which to do it. So let's dive right in. Chris, by the way, I don't know if your camera is on right now or not. I'm seeing a black screen. So
I can see myself. Hold on a sec.
Yeah, just a heads up about that.
Can you see me now?
Nope, we're still seeing a blank screen.
Oh, I can see myself reflected in the studio interface.
There you go. Now we can see you. Welcome to the stage. All right. Great. So let's go ahead and dive in. So Chris, how about if we start with you? Maybe you can talk a little bit more about your work and, with AHA and supporting workforce well-being.
Okay, great. Thank you, Guillermo. It's really wonderful to be here with you and Carla today to talk about a topic that's very important to me. At the American Heart Association, I lead our national health and well-being strategy, which includes workplace health and well-being and mental health and well-being. And so, you started us off by, quoting a number of very concerning statistics about mental health in the workplace. And certainly COVID has had a dramatic impact on the mental health and well-being of the workforce. The American Heart Association is the nation's largest health nonprofit organization, and our mission is to be a global catalyst for a world of longer, healthier lives. And so we achieve our mission by shining a spotlight on the importance that science and policies can have on shaping healthy environments so that we make the healthy choice the easiest choice for people to adopt. So one example of that is, most workplaces now are tobacco free. They weren't in the 1960s. and the passing of policies like tobacco-free work sites had a significant impact on reducing the number of smoking adults in the United States. So that's one example of how policies can be used as very effective instruments to, change environments that lead to healthy outcomes. At the American Heart Association, we are tackling mental health and burnout by promoting science-based policies to prevent burnout in the workplace. Previous studies have shown, and your data reinforces the fact that the US workers are among the most stressed out and burnt out workers in the world. And according to the World Health Organization, burnout is chronic workplace stress that has not been successfully managed. And so we are approaching mental health and well-being at the American Heart Association by really focusing on the role that chronic stress, including workplace burnout, plays on the health and well-being of U.S. workers. And our approach is to provide business leaders like Carla and like the folks that are watching this event with science-based policies to prevent burnout in the workplace.
Fantastic. And Carla, maybe you can tell us a little bit about yourself as well as Texas Health.
Sure. I just want to thank you, Guillermo and SHRMLabs, for the invitation to talk about this. We are based in Dallas-Fort Worth, and we are a health system, and we have almost 29,000 employees. So their well-being is very near and dear to my heart. And as Chris said, burnout is a significant issue in the workplace, and it's probably one of the biggest challenges that we have is to remember to take care of ourselves. It's something I am struggling with this week, having COVID, wanting to work, but knowing that I had to take that time for myself. And that's especially true in healthcare, where we're so focused on caring for others. So we've got to care for those who care for our patients. So it's very much like when you get on the airplane and they say, put your mask on first before you help others. So we really look at this from body, mind, and spirit. It's all of those things. And during the pandemic, we adopted a mantra that we continue to this day. And it's okay to not be okay. We dealt with a lot. We saw a lot during the pandemic as a hospital system. And the last 3 years have certainly taken a toll on us and our frontline caregivers who feel emotionally exhausted, drained, and burned out. So we have developed a building resilience managers toolkit that has all kinds of listening techniques they can do with their staff, group exercises, strategies for those that are managing teams virtually, and a host of things to help managers develop resilience among their teams.
Fantastic. Yeah, as a matter of fact, I just got done earlier this morning talking with a director of operations at an HR or director of operations at a health-related organization as well. That's much smaller than Texas Health. But the discussion was around burnout and what they're doing with their staff. So Chris, maybe you can talk a little bit about the research that AHA has been doing and the impacts on the different types of workers and the workforce as a whole.
Yes, absolutely. So earlier this year, the American Heart Association partnered up with Harris Poll to conduct a large national survey. We were interested in finding out, what type of workers are most at risk for developing burnout, and what impact do the science-based policies that we recommend in our workforce well-being scorecard, what impact do those policies have on employee health and well-being? And so the headline statistic is that 82% of respondents said that they experience burnout at least some of the time, and 1 in 4 employees are saying that they experience burnout always, almost always. So that's a really worrying statistic if you think about the sort of physical and mental toll that these employees are experiencing. And what we also found is that there's a health equity issue when it comes to burnout, because different types of employees are experiencing much higher levels of self-reported burnout. So our study shows that women, LGBTQIA employees, frontline workers, and low-income workers and parents are the 5 groups that are reporting higher levels than that 25% or 1 in 4 employees. So there's definitely an equity issue when it comes to burnout that needs attention. And the 3 top reasons cited for why employees experience burnout was lack of recognition or reward for the work that they do, not having input into the design of their job functions and their roles and responsibilities, and then lastly, having unsustainable workloads. And so that's the bad news from the survey. The good news from the survey is that policies seem to make a difference when it comes to how employees experience well-being and burnout in the workplace. We have 9 recommended strategies that employers can implement in the workplace to reduce the risk of burnout. And they are contained in our workforce wellbeing scorecard, as I mentioned. And the top line finding was that when companies do not implement any of the 9 policies, employee well-being is 51%. When they implement all of the 9 strategies that we recommend, self-reported employee well-being goes up to 91%. So there's a dramatic increase in how employees perceive their overall health and well-being when employers implement science-backed policies to reduce burnout in the workplace.
You know, it's interesting that you brought up parents, right? And this week, childcare was in the news. You know, because of some of the, you know, the funding discussions that are going on, and you know, if I remember correctly, the statistic or the number that I heard is that 3 million kids are gonna have a hard time finding childcare when the funding runs out or something along those lines. So I can only imagine what, you know, the stress that's going to cause for parents. Carla, for Texas Health, you know, how do you view these results?
Yeah, as you can imagine, healthcare is a high touch and high stress business, both physically and emotionally. So we believe our ability to deliver on high quality, reliable care depends on our employees being supported and cared for to be their best. So we are 80% female. So we fall into one of those workforce segments that Chris mentioned is impacted by burnout. So knowing that, we make it a priority to support our employees. At Texas Health, everything for us ties back to our Texas Health promise, individuals caring for individuals together. It's simple, 5 words, but packed so much meaning into them. We created it in 2006 as a way to translate our mission, vision, and values into principles and behaviors. So make it real for the individuals. It's been our true north and our unifying force for almost 2 decades. And we translate it in 2 ways. One is caring for our patients, and the other is caring for each other. So we've woven that into our strategy, our programs, and patient care. And Chris mentioned the Workforce Wellbeing Scorecard. It's a tool that we've used at Texas Health. So we've used the questions in the scorecard to help us stay up to date on trending wellbeing programs and initiatives. It helps us identify gaps that we may have, and then we use it along with other data to inform our programs. So a few tangible examples of what we've done is an employee assistance program that is a Texas Health program. It's not from an external vendor, that provides everything from mental health well-being to financial assistance. We offer time off, and more importantly, encourage our employees to use it. That's not always the case. We have also created an inclusive environment where everyone is encouraged to be their authentic self. Safety is a huge issue within healthcare, so we're focused on that, as well as stress management and sleep improvement. And then we realize that families are such an important part and an extension of our employees, so we offer benefits and programs that support family, adolescents, and pediatric mental health as well.
Fantastic. And one thing that's great about what you just said is that you're showing how you're creating a culture that destigmatizes burnout and promotes a culture of mental health and well-being. Which is it's one of the key issues that's out there, right? That mental health is still stigmatized. So fantastic. So I know that there are a lot of policies employers could implement to help resolve some of these issues. What do you think are the top two that you would recommend employers look at, and how could technology be a part of that? Let me throw that out there, Carla or Chris, whoever wants to go first.
So thank you, Guillermo. I'm not going to talk about all 9. I wanted to highlight 2. One that addresses one of the top 3 reasons for burnout, which is workload, and then one that our research shows needs a little bit of improvement. And so the first one is to annually assess workload through the formal performance review process. 3 out of 5 respondents from our national said that they have at least sometimes unsustainable workloads, and your SHRM data, showed, I think, the same finding. So, giving employees the opportunity to formally and giving them permission to discuss their workload with their manager through the annual performance review, at least annually, more would be great. Maybe quarterly check-ins. Allows the manager and supervisor to make any adjustments to the employees' roles and responsibilities to reduce their risk of developing burnout. And according to our research, only a quarter of US employees said that their employer currently has that policy in place. And our findings also showed is that higher income employees and more senior executives were far more likely to benefit from this policy compared to frontline workers and low income employees. So it's really important from an equity perspective that employers consider implementing this policy for all of their employees, not just for some of them. And so the second strategy that needs some improvement, which I think is really important to the discussion today in this forum, is having a written organizational policy on the use of technology after standard working hours. Recognizing that the definition of standard working hours may vary depending on the type of organization. So standard working hours in healthcare or manufacturing is going to look very different to standard working hours, say, in a finance or a tech company. But that can be defined by the organization. So 65% of the people we surveyed said that they are emailing late at night and talking to their supervisors after working hours. And only about 1 in 4 employees said that their organizations currently have a policy like that. And this policy is associated with improved employee well-being, but it's not associated with a reduction in burnout. And I think what that demonstrates is that simply having a policy on the books without actually creating the organizational culture, especially with leadership support, does not necessarily change our behavior, right? It could. What we don't want is we don't want this just to be simply a question of checking the box. We want this policy to be meaningfully implemented. Now, technology is already starting to play a role in this issue. So, for those of you who use Outlook, Outlook now has an automatic prompt that when you're trying to send an email late at night will prompt you to think about sending the email during working hours, and it even allows you to, schedule it for you at the right time. So that's one example of how technology can help. I'd be fascinated to know, from the audience today, how can technology itself be used to solve the problem of technology?
Fascinating. By the way, I didn't know that had that's an improvement that Outlook has, but it's great to know. And actually, it makes me think of a country like Sweden, for example. I think Sweden has clear, and it might come actually from the government, where they have clear policies on when you can use all the great technology that is out there. Right. So, Carla, thoughts around that?
Yeah, Chris is right. Phones and devices are amazing tools, and we oftentimes feel tied to them. For us, it can be challenging because hospitals are obviously 24/7. My role, I'm on call always. So there's not really a closing time or after hours for us. But one trend that I do see is, hours in an email signature, because we do have so many different schedules. And it starts at the top as well. I have personally used what Chris is talking about. I am not a morning person. I do better at night. But what I found was my team would be responding. And especially ones with young kids. And so I have used the prompt that Chris talks about, which is scheduling the email to be delivered the next morning. So I'm still working during my prime time, being effective, productive, but I am not taking away from their family time. I think the other thing is for us, and I mentioned PTO earlier, is taking that time off. It's something I definitely saw during the pandemic. We were working 7 days a week, having multiple incident command a day, dealing with all the volumes. And I remember having a conversation with my boss, who's the CEO, and saying, you know what, I think that I can't get people to take a day off. I think what I'm going to do is I'm going to take a day off. And it was like a random Tuesday, and the day within 24 hours of me announcing to my team that I was taking that day off, every single one of them had requested time off. So I think that's the other part of this is leaders need to walk the walk. We can't just say it's okay to not be okay and then not talk about our struggles. I was diagnosed with breast cancer during the pandemic, so I didn't have any choice but to be vulnerable. But unless we are showing that to our staff that it's okay, then we have not created that psychological safety and let them know that it truly is okay to not be okay, and we're all in this together.
Yeah, absolutely. And we're just so connected these days, right? I mean, you feel like you're connected 24 hours a day, and sometimes you really need to step back. As a matter of fact, I think it was last week or recently, I was having a discussion with my team in which I, kind of shared some insights around what it was back in the late 1990s. I remember when snow days used to, I don't know if you have them down in Texas, but up here in the DC area, we certainly used to get snow days, right? And it would be a true snow day, and the offices would close. But now you really can't do that, and especially with so many people working remotely. So, Chris, I know or actually, Carla, maybe you can talk a little bit about, THR's approach about burnout prevention for its employees, and how you guys utilize technology as a solution.
Sure. It can contribute to burnout, but it also can be a tool. It can be a great tool. So I talked earlier about our Building Resilience Manager Toolkit that has resources to provide emotional, mental, and spiritual well-being, confidential counseling. So whether that is in person, whether that is telephonic, where it's on a video, where we're trying to meet the individual where they are. They can do virtual group psychological first aid. when a tragic event happens, online courses for reducing stress, and then in all of our hospitals, we have chaplains as well. Technology can also help from an AI perspective, reducing the burden of caregivers from a documentation perspective. And then we added this year, free of use, the premium version of Headspace app, and have had great utilization of that. And then, as I mentioned, the key is ultimately to listen and reduce the stigma of asking for help, whether that is self-care, leader rounding, which we require in all of our facilities. We do have on-site EAP at many locations. We also survey our employees multiple times a year and ask them, what can we do? What things do we need? One of the things that we are adding for 2024 is what is called My Flex Day, which is a paid day for every individual to use, whether that is a mental health day, whether it is for a religious day, whatever it is for their day. It is not part of what they already have, it's an addition. And so all of these things help address what's happening. I think the biggest thing is it's not one size fits all. You have to have a lot of different tools, including the ones that we use for the American Heart Association, and get those best practices out there to best meet the needs of your employees.
Yeah, and one tool that I'll mention that we've been seeing some of our members deploy out there are also the use of chatbot. And you mentioned AI, right? And so some employees out there are actually prefer to just have a conversation with a chatbot, instead of having one with directly with a person. Obviously, that's an area that we could sit here and talk for hours, but I just wanted to mention that out there. And a great company that's doing it is a company called Humaxa, which is part of our portfolio of companies. So Chris, are there any valuable resources that HR professionals watching this might find helpful out there that you can share with them?
Yes, so we're releasing the full survey report on October 10th, which is World Mental Health Day. And we'd be very happy to share that report with the folks who are on the event today. But in the meantime, I would encourage HR managers to look at our workforce well-being scorecard so that they can get their free assessment and their benchmarking report that Carla was mentioning. And we're obviously very grateful that Texas Health Resources participates in our program. And so you can visit www.heart.org/workforce, and there it's on the screen.
Okay, fantastic. And then just one quick last question for the two of you. We're coming to the end of 2023. Any big trend or final trend for 2023 that you think might manifest itself?
So when we talk to CEOs through our CEO roundtable at the American Heart Association, their number one concern when it comes to their people is the mental health of the workforce, for exactly the reasons that you cited, Guillermo. When you look at multiple surveys in the last year, high levels of distress in the workforce, especially amongst historically underrepresented employees like frontline workers, low-income workers, and also younger workers who are entering the workforce for the first time are reporting much higher levels of mental health issues and burnout in our survey also. So I'm not sure that's a trend because it's an ongoing concern, but that's what we're hearing from our leaders. Carla, I'd be interested to see what your thoughts are.
Yeah, I think it's continued. There needs to be the continued focus on mental health. I think there is a sentiment among leaders of, okay, we're over the worst of it. We can get back to normal and that does not exist anymore. So I am concerned about a disconnect between the front line that Chris just mentioned, still dealing and grappling with all the things that we haven't come to terms with, from inflation to the pandemic to social unrest, and a sentiment of leaders to move on and go to the next thing. And so I think there could be a desire to not talk as much about mental health. And I still don't think that we have seen how big the iceberg is. We have seen the tip of the iceberg.
Yeah, I completely agree with the two of you. Absolutely. And that was a great analogy, actually, to think about it as an iceberg. Absolutely. Well, unfortunately, that's all the time that we have for today. Carla and Chris, thank you so much for joining us. This was a great and needed discussion, and for our audience out there, I hope you all enjoyed it as well. So thank you for being here, and thank you all for tuning into the SHRMLabs Workplace Tech Spotlight. If you enjoyed this live stream, please share it using the hashtags SHRMLabs, Workplace Tech, and SHRM, and visit us at SHRMLabs.com to stay up to date. We'll see you next time. Thank you so much for joining us. Have a great weekend.